My name is Skylar Piscopi, and I'll be talking about HIV and AIDS in the Ukraine. So, some background on Ukraine. It has a total of almost 36 million people, and of those people, 77.8 are Ukrainian, 17.3 are Russian. Majority of the population are Christian, specifically Orthodox. The average age is 44.9 years old, which this graph kind of goes into. 70.7% live in urban areas. Total school life expectancy is 15 years, which is good. Compared to the US is 16 years, so they're not far behind. Currently in a war with Russia, and poverty has increased by 1.7 times due to the war. So this is the map of Ukraine. This is how close Russia is, and they're in a war in this area right now. The prevalence in the Ukraine right now is at a rate of 0.66 to 1%. And the incidence is, right now there's almost 10,000 new cases of HIV, and of those, almost 3,000 diagnosed with AIDS, and of those, almost 2,000 dying from AIDS. So the most common mode of transmission is injectable drugs, so people who are hooked on drugs or need them for medical reasons. There's little supply, and so now people are resorting to sharing dirty needles, and more HIV cases are on the rise. And then, of course, homosexual relations. So there's been a higher need for pre-op drugs, but being in a war state, distributing these medications has been especially hard, especially in eastern Ukraine. Okay, so populations most impacted, so people who inject drugs and anyone in relations with these drug users. So 70 to 80% of new infections are heterosexual people that do not inject drugs. 50% of HIV infected people are unaware of having the infection, so someone could not even realize they have it, have sex with someone else, give it to them. This kind of goes hand in hand with this last data point, and this also kind of goes hand in hand with this. If you're in a relation with a drug user who doesn't know they have HIV, you could get it. And obviously people in homosexual relations. This chart just kind of goes into how war has dismantled HIV preventions and care, if you want to look into that. So right now, there are 122,000 people getting the art therapy treatment. Over 12,000 people are getting the pre-op for HIV. So those are the drugs given out or the medications. They also offer early testing for early detection, as that also plays a crucial role. How is it paid for? There has been a bunch of different groups that have come together to help ensure continued availability of these drugs and medications for these patients. The United States President's Emergency Plan for AIDS Relief has taken over purchases of the art therapy for people with HIV. Before this, 80% was funded by the Ukraine, but Trump recently did put a hold on this, causing disruptions. So this is kind of a graph of where treatment centers are. The Eastern Front, a lot have been closed due to the war. So some political characteristics. Obviously, there's the ongoing war with Russia. This has disrupted healthcare infrastructures, especially those that have been occupied by Russia, are now occupied by Russia, or have been destroyed. So if you look here, 78 days there has been with attacks on hospitals, and also over 300 art treatment centers have been affected, either destroyed or closed. And then in the sites occupied by Russia, where war is happening, there's no way to deliver proper medications. And then due to policy shifts in government instability, so changes in leadership, especially in the United States, has delayed or disrupted HIV-related programs that aimed at helping the Ukraine. So the social characteristics, there's obviously stigma and discrimination. So people with HIV face stigma every day. I highly suggest, if you have a chance, read this girl's story. Lisa, she was born with HIV, and she kind of goes into the nitty-gritty of how she's faced discrimination her whole life and how she's fighting for that stigma to be diminished and for universal treatment all over. There's even more concern now with this ongoing war. It has totally set back the work that has been done and elongates the work that needs to be done to end the stigma of HIV. And then obviously there's limited HIV awareness. Ukraine has the second highest burden of HIV in Europe. There's 350,000 people with HIV. Of those people, 25 are even unaware that they have the virus. So some economic characteristics. There's been some cuts in foreign aid. This chart kind of goes into how U.S. aid, organization that provides aid to foreign countries from the U.S., the Ukraine is its number one beneficiary. This has been cut by Trump, so it kind of goes into the effects of that. So that's an issue. And then, of course, the budget of Ukraine is right now focused on the war at hand. So HIV is kind of being put on the back burner. And then, obviously, poverty is on the rise in Ukraine. So people can't even afford food on their table. And they are not worried about getting to a spot where medication is provided or testing is provided. Okay, so health science connection. So obviously being able to understand the science, apply my knowledge of how HIV is transmitted, and going into the public health of it as well. Promoting any new or already used evidence-based intervention, and even more education. Obviously promoting health equity, wanting to end stigma related to HIV is important. And then improving the systems and access that have already been created, so contributing to create more and even better programs, clinics, and better education worldwide, especially in disadvantaged communities. These are my references.